All right. Welcome, everyone, to our Wednesday webinar on code compliance and purchasing formula. Our speaker today is Marcia Walker, who is the Executive Director of the National Alliance for Breastfeeding Advocacy. Before she gets started, I just want to remind everyone to mute your line, which you can do by pressing *6. And if you need to unmute to ask any questions, you can just hit #6. And just a reminder not to put your phone on hold, otherwise the music will play for everyone. Okay, I think we can get started. Marcia, if you're ready.
Thank you. Thank you, everyone, for joining us today. Today we're going to talk about code compliance and purchasing formula. And I know this is not as probably as tantalizing a subject as some of the others that you are working on if you're working towards the baby-friendly accreditation. But it is an important part of baby-friendly and an important part of how we practice. So I thought I'd talk a little bit about what is the code, why do we bother with it, why do you have to worry about it when you're working on baby-friendly, and what does it mean for everybody? So if we look at what is the code, it's a set of recommendations. It's not a law. Countries must legislate marketing types of activities. So the code is a set of recommendations from the World Health Organization and UNICEF. And what it does, it's a guidance towards regulating the marketing of breast milk substitutes, which is infant formula and a number of other types of products. And it also covers feeding bottles and artificial nipples. Now, the code was formalized. It came about when people realized that poor infant feeding practices in the hospital were negatively affecting the growth, the health, the development of children, and were a major cause of morbidity and mortality in infants and young children. So this became a very large issue. What the code wants to do is provide safe and adequate nutrition for infants by protecting breastfeeding and by ensuring the proper use of breast milk substitutes, formula, when it's necessary. And it wants to make sure that all decisions and workings on this are based on adequate information and appropriate marketing and distribution. Now, the code advocates that babies be breastfed, but it says if they're not breastfed, they should be fed safely on the best available nutritional alternative. So the code does talk about formula feeding and safety of this. But basically what the code is it refers to marketing practices of manufacturers and distributors, not the use of the product. We know that bottles and formula are sometimes necessary. They're sometimes medically necessary. They're sometimes necessary due to certain circumstances. So it's not that formula cannot be used. The code itself is only about marketing. How are these products marketed to the public and to healthcare providers and healthcare institutions? So what it aims to do is to reduce deceptive and unethical marketing of products that are covered under the code. And that's because some of the marketing that's out there can induce mothers to avoid or abandon breastfeeding. And it may convince mothers and healthcare providers that breast milk and formula are equivalent, which they are not. So we're looking at, again, how the product is marketed, not if it's going to be used, but how it's going to be marketed. So what is deceptive marketing? What are we talking about here? Well, this particular product just came out, this Similac with human milk oligosaccharides. Now, human milk oligosaccharides are a very important component in breast milk. And these oligosaccharides in breast milk, and there's probably over 200 of them, are an army of anti-infective properties. So putting something into formula and saying that it is similar to breast milk is a marketing tactic. Now, if you look very closely at this ingredient does not come from human milk, even though it says human milk oligosaccharide. It's actually fermented from a non-pathologic strain of E. coli. Now, the label doesn't say that, so parents don't know where this ingredient comes from. When you look at this, they assume that it's from human milk. And I even had a mother the other day, and this was scary to me. I had a mother the other day when we were talking about infant formula and making some decisions. She asked me, whose breast milk is used to put the oligosaccharides in this formula? In other words, whose breast milk was being put in there? And I said, well, nobody's breast milk is being put in there. I said, this is an artificial ingredient. And many mothers do not understand the sourcing of some of these ingredients. And you can look in quotations down here. This is from the Abbott website, where it says, discover the first and only formula with human milk oligosaccharide, an immune-nourishing prebiotic previously found only in breast milk. And when we start seeing this type of text, this is what the code is talking about in terms of how the product is marketed. This is a code violation. In other words, it violates the tenets of the code. Now, what's in this code? Do we have to read 500 pages to figure it out, or can we boil it down to something that we can do in an hour on a webinar? And so I thought this was very nicely summarized from La Leche League, and I shamelessly took it from their website. Now, what does the code cover? Well, it covers infant formula and any food or drink that would substitute for breastfeeding, like teas or foods aimed at babies that are under 6 months, okay? And formula aimed at any age. It covers feeding bottles. It covers artificial nipples. Now, who's expected to follow the code? Well, obviously, the manufacturers and distributors and retailers of any of these items, healthcare workers, that's us, professionals and volunteers, and healthcare facilities, hospitals, clinics, anything basically in the healthcare system, as well as professional organizations and associations. The code talks about what needs to be on the label. The label on these products needs to be in the local language so people can read it. It's supposed to include the hazards associated with artificial feeding, and the labels are not supposed to use idealizing language like I showed you in that previous slide, or images of happy babies, fat babies, this type of thing. Shields that make people think that this formula is going to protect the baby from disease. This type of stuff is very misleading. So the code is asking, hey, we don't need this on here. We don't need to deceive mothers. Let's just tell them the truth here. So what is allowed under the code? Well, certainly the use of formula with safe preparation for babies who need it. The code doesn't say anything about not feeding babies. If they need to be fed, they need to be fed. Sale of products with technical information, and that's fine. Companies are allowed to sell feeding bottles and infant formula as long as the text is factual. And this would, like with a bottle, it would be polycarbonate, 4 ounce, 8 ounce, this type of thing, factual information. Accurate information on safe formula preparation is required on all labels, and basically that's not on the labels. So what's not allowed? Promotion to parents, advertising, free samples, promotion to health professionals, gifts, free samples to people like us, promotion in health facilities, posters, free formula, gifts. This is why Baby Friendly is asking that this not be in hospitals that are baby friendly. Promotion of unsuitable products for babies. The code itself has 11 articles and 17 resolutions. Now, the code was first enacted in 1981, and it is revisited every 2 years by the World Health Assembly to fill in any gaps or loopholes in the code, and that's to make sure that the code is current and updated. In 1981, we didn't have the internet and social media. We weren't glued to our computers and our mobile electronic devices back then. So as the years passed, these subsequent resolutions have filled in some of the gaps and talk about these issues as they come up. So the aim of the code is to protect and promote breastfeeding by ensuring appropriate marketing and distribution of breast milk substitutes. The scope of the code, you can see what it covers here, which I've listed. Basically, what we're mostly interested in is infant formula, follow-on milks, feeding bottles, and artificial nipples. The third article, no advertising of the products to the public, no samples, no free samples to mothers and their families. And this is when we get into the discharge bags in the hospital or bottles of formula that are being given to mothers when they leave, this type of thing. Healthcare facilities such as hospitals or clinics where we don't promote or advertise these products. There's no displays, there's no posters, there's no handouts, this type of thing, no promotional materials. Now, if you look at that picture on your right, do you see that little picture of that Christmas tree on the right? This is a Christmas tree that was set up outside of a maternity unit. And what it's decorated with are Mead Johnson formula boxes and cans. Now, this is outright promotion of a product. And this again, is what the code is there for. People walking into that unit should not be given a commercial before they step foot in there. Number 6, health workers. No gifts or samples to health workers. In other words, we should not be accepting anything. There we go. No free or low-cost supplies of breast milk substitutes to any part of the healthcare system. Now, this is why your hospitals are being asked to purchase formula. Formula is food for babies, for patients. There is no other unit in the hospital that gets free food except the maternity unit. Every other unit in the hospital has to pay for its food. And food is part of the room and board charge of the patient in the hospital. So nobody walks onto the cardiac unit and gives them free chicken nuggets for the patients. Okay. All of the food in the hospital is paid for, and then that cost is borne by the room and board charge. And that's the way this typically works. So information, number 8, information and educational materials must explain the benefits of breastfeeding, the health hazards associated with bottle feeding, and the costs of using infant formula. Labels. Now, labels are a big part of the code. Now, the product labels, again, must clearly state the superiority of breastfeeding, the need for advice of a health worker, and a warning about health hazards. And there shouldn't be any pictures or idealizing text on the use of infant formula. Now, this is the label on a can of infant formula. And it says on the top, experts agree on the many benefits of breast milk. If you choose to use infant formula, ask your baby's doctor about Enfamil. Well, that doesn't quite do the job that the code is asking for, nor does the preparation. Okay, and it's interesting what it says here, and that is this is powdered formula. It says powdered infant formulas are not sterile and should not be fed to premature infants or infants who have immune problems. That usually goes unread by many people. Okay, there is no powdered formula that is sterile. So preparation of the formula is very important. And the label is supposed to have the preparation instructions on it. That's why Baby Friendly asks you to talk about infant formula preparation in the correct manner, because many times it simply is not read. And then number 10, unsuitable products should not be given to the babies. This is another example of labeling. And this is Mead Johnson's new Inspire formula, where it says our closest formula to breast milk. Our closest to breast milk is a misleading or deceptive type of marketing, and this is what the code is asking that not be there. If you look at the side of that label, it says our closest formula to breast milk. It talks about lactoferrin, one of the immune system supporting proteins also found in breast milk. Again, it's this implication of equivalency. Milk fat globule membrane, brain nourishing lipids, also found in breast milk. So you can see that brain-nourishing nutrients also found in breast milk. It implies that these same things are in this infant formula and is deceptive marketing. Now, breast pumps are not covered by the code. So we don't, whatever we feel about breast pumps, however they're marketed, good or bad, good, bad, and ugly, they are not covered under the code. So we don't need to worry about them code-wise. Collection and storage containers are not products that are covered under the scope of the code. In other words, the bottles that are used with a breast pump to collect breast milk, or bottles that are used to store breast milk, those are not covered under the code. So they can be marketed any old way they want, according to the code. So what do these code violations look like? What are we looking for here? Well, free samples and supplies. This is why hospitals who are going for baby-friendly are asked to purchase the formula and not give out samples to mothers, because it's part of the code. Free formula to hospitals, to pediatric offices, mailed to mothers through formula clubs, starter packs, discharge gifts. These are all code violations. Formula contracts that bind hospitals to give out formula discharge packs. And there's a discharge pack in that the lower right-hand picture. Now, I'm from Massachusetts, and in Massachusetts, none of our hospitals give out formula company discharge bags. They have all eliminated that practice. We're one of the states that have done that, so we haven't seen these for quite a long time. And it's important because those discharge bags are a very, very effective form of marketing. 95% or more of the mothers who receive these bags and that formula in the hospital will go on to purchase that same brand. Now, these are the pricey brands of formula. They're not the store brand formulas. So I once found the example of formula discharge bags in a marketing textbook under a section that talked about effective marketing tactics. It was so effective, these are so effective in terms of marketing, that they're even in marketing textbooks. Hospital enticements. Mead Johnson purchased 500 licenses for this product. I don't know if any of your hospitals use this or not, but it's a tracking and inventory management system for breast milk and actually for formula too. And what they did is they bought 500 of these licenses and offered them for free to hospitals if they would not become baby-friendly. Now, this was appalling to me, and it's frightening, because the baby-friendly and not giving out these discharge bags and working towards reducing the marketing of the product through the healthcare system is a very potent message to formula manufacturers. Okay, this is one of the main ways that formula is marketed, and that's through the healthcare system and through people like us. What other things in the hospital do we need to eliminate, or that might be used as a mechanism for promoting these products? Well, certainly posters, calendars, clocks, stickers, weight charts, teaching flip charts, measuring tapes, crib cards, you name it. We've seen these logos and this type of supplies and equipment being given out to hospitals throughout the country. And again, these types of things are code violations, and they should not be there. Gifts to health workers. Okay, using gifts as inducements to promote the products. Pens, mugs, notepads, growth charts, all those trinkets. Bigger trinkets like Club Med membership, ski trips. Here in the East, we were seeing formula companies sending healthcare providers to ski resorts. Tickets to sporting events, food, cash to hospitals, continuing education programs. All of this type of incentives are incentives for hospitals and healthcare providers to look kindly upon the use of this product. And the pictures here, that picture on the right is showing a name tag that says Enfamil on it. So when a nurse would wear that name tag and would lean over to talk to a mother, What was at eye level was the name or the word Enfamil. And so that was kind of front and center in terms of what the patient saw. Samples and gifts to mothers. Well, this is where formula discharge bags come in. These discharge packs should not be given to the mothers. But we see that when they're not given in the hospital, we see them moving to the obstetric offices or the pediatric offices. We even found these things in an ultrasound office. When my moms were going in for ultrasounds, they were given packs of formula. And so the code is asking that this not be done. Sponsorship. Well, what is this? Well, it's funding. Okay. Any type of funding that comes into a hospital or to a healthcare provider or to a professional association could influence the objectivity of the training of this person. Okay. Financial support for professionals should not be creating conflicts of interest, and that's what all of this does. And so we don't want to set up a situation of a conflict of interest. Our duty is always to the patient. Financial assistance from infant feeding industry can interfere with the unequivocal support of breastfeeding. And I've heard people say, oh, well, don't worry, your baby will do just as well on formula. Well, that type of a statement is not true. And the code is asking that we that we always maintain our unequivocal support for breastfeeding. What else is covered? Well, feeding bottles and artificial nipples, something that idealizes bottle feeding or markets the concept of equivalency. Bottles and artificial nipples are nothing like the human breast. They don't work the same way, they don't look the same way, they don't act the same way. Yet some of the marketing practices will kind of dupe people into thinking that these bottles and these artificial nipples are going to be just like breastfeeding. So these types of ads are code violations, favored by moms and dads because they reduce feeding problems, okay? What these types of ads are saying is that the soft, slow flow silicone nipple on the left simulates mom's natural shape and helps make it easy to combine breast and bottle feeding. Okay. Now, I don't know about you, but that nipple doesn't look too much like what I've seen on most mothers, and neither does the one on the top. The one on the picture on the top right is supposed to be mimicking what the breast looks like to the baby. And again, I haven't seen too many that look like that. But it is very deceptive in terms of the marketing to mothers because you look at that and say, oh, it's just like my breast. The formula is just like my breast milk, so why should I bother breastfeeding? It's all the same anyway. This bottle, the Calma bottle, that again is deceptive marketing. Okay, and this is a code violation. Okay. With Calma, switching from bottle back to breast has never been easier. Okay. Mimics natural feeding behavior. Your baby can feed, pause, and breathe, similar to breastfeeding. That's a code violation, okay, because it implies equivalency between that bottle and artificial nipple and the mother's breast. So marketing is nothing new. This has been going on since the 1800s, and that's what this little picture on the right shows. Okay? And what he is doing there on the right is giving the ladies there samples of his soap. So sampling has been going on for a long time. It's a very effective marketing tactic. And we know that if somebody receives a sample, they're much more likely to purchase it when they go to the store, because it creates brand loyalty, a positive brand image. Ooh, they gave me something for free, so I'm going to try this. I know what it looks like. And this is why samples are sent directly to mothers' homes. Many of these mothers receive cases of formula before they ever deliver. So formula discharge bags is product sampling. It's not a gift. Okay? Hospitals have been giving out formula samples since the 1930s. It's viewed as an endorsement from the healthcare provider rather than an advertisement. That's what formula companies want. Okay? They want us to do their marketing for them, because when this product is given to a mother by a healthcare provider, it's viewed very differently. It's not viewed as an advertisement. Okay? HIPAA defines this as a form of marketing. Okay? And basically what this gift giving does in the terms of, from the formula company's perspective, is it creates a market where none existed before. If a mother's going to breastfeed, she's likely not to use formula. So there's not a market there for her. So they've got to create the market, and they do that very well. They also create a sales force, and that's us. Sponsorship, funding, supplies, services to hospitals and healthcare providers can influence medical care patterns, and that's been studied and researched, and that's in the literature. We don't want any distortion in the accuracy, the completeness, and the balance of information presented to mothers. That's what the code is asking, and that's what Baby Friendly is asking. This quote was taken from an old Abbott, back when it was called Ross, an old Abbott employee's manual. And it illustrates to me very, very clearly what a formula company thinks about nurses. Now, I'm a nurse, and this just was insulting to me. So this employee manual stated, never underestimate the role of nurses. If they are sold and serviced properly, they can be strong allies. A nurse who supports Ross is like another salesman. Now, salesman is not in my job description, and I know it's not in yours. And I hate this quote. I think this is very demeaning. So what happens with gifting? Well, clinical judgments can be biased by small gifts. Okay, that's why they're given out. So we don't want anything that would potentially conflict with a provider's ethical duty to the patient. Okay? Educational offerings, these mugs and trinkets and all of this stuff can undermine professional objectivity. And all of this is designed to cause hospitals and healthcare workers to look very kindly upon infant formula products and disrupt the unconditional support of breastfeeding. That's what's behind the marketing tactic. Now, this study showed very clearly that when mothers received these sample packs at discharge, that it was associated with reduced exclusive breastfeeding at 10 weeks and out to 6 months. And our goal here is to promote, support, and protect exclusive breastfeeding. We don't want to be giving mothers things or items that are going to interfere with that. Okay. This is a discharge bag, and it advocates for breastfeeding, but it promotes formula by distributing commercial bags, causing confusion in mothers. And this came from the AAP. In this particular discharge bag, you can see that the AAP had this tag hanging on it on parenting tips. And it had a booklet inside that was provided courtesy of Mead Johnson. So you can see that this causes confusion. Well, on the one hand, you say I'm supposed to breastfeed, but then you give me all this formula. Now, gifts have strings attached. They are the wolf in sheep's clothing. It can distort informed consent. It can prioritize financial issues above patient care. And it challenges ethics of our professional duties. Okay? It exploits patients' fears of inadequacy. I've heard mothers say, well, you know, I gave my baby formula just in case I didn't have enough vitamins in my milk, or just in case. Okay? It implies medical endorsement of formula. And hospitals are used as a marketing arm for formula companies, and we don't want that. Hospitals are not there to market products. They're there to market health. And that's what you do. That's what you're working so hard to do. All those hours you put into helping mothers, all the hours you're putting in to become baby friendly, all the hair pulling that's going on over this, we don't want to lose sight of what we're after here. And this, again, is why Baby Friendly and the code are so intricately intertwined. The code is part of the foundation of Baby Friendly, okay? And it wants to protect new parents from the influence of vendors of these items, okay? We want to make sure that vendor and their ethics make sure that there is appropriate interaction between vendors and staff. Okay? This is why vendors should not be allowed to just walk on the maternity unit with pizza and trinkets and give it out to nurses. Okay? That's a code violation, and that's why that type of thing is discouraged. So why do we have to turn away all of this stuff? On the surface, it sounds like, hey, all this free stuff's very cool. You know, we might be able to use this. Well, acceptance of funding or other incentives creates a sense of obligation and loyalty to the company in question. It invokes what's called the concept of reciprocity. Ooh, you've done something very good for me, so in return, I'm going to do something good for you. Okay? We have a moral obligation to protect our patients from inappropriate promotion of breast milk substitutes and from resulting competing interests. Okay? Hospitals have an obligation to respect and protect women and children's rights to be free from all forms of marketing practices. Mothers should not go into the hospital and be a target for marketing. Okay? So why do you have to buy formula? I mean, it's freely given to hospitals. Well, like I said before, the maternity unit is the only one that receives free food for its patients. Okay? The only reason that free formula is given to a hospital is to market that brand to new mothers. Okay? Our job description doesn't include marketing pricey products to vulnerable patients. We don't do that on any other unit. The cardiac unit does not market Big Macs to its patients so that they'll go out and buy that stuff and come back in 6 months with another heart attack. So we don't do that in any other unit. Formula manufacturers know that whatever brand the mothers are given in the hospital is the one they're very likely to use when they go home, when they're discharged. So giving out all of this stuff, free samples, pamphlets, growth chart, whatever is given to these mothers from these companies, it implicitly endorses formula feeding. And the code and Baby Friendly, again, are asking that that not be done. So what can we do here? Well, let's see if we can get these formula discharge bags out of the maternity units. My experience has been with Ban the Bags, which I am part of, that when these bags are removed from the hospitals, the patients don't really notice or care. We have had very few hospitals saying that the patients got up in arms about not getting a free gift from a formula company. So patient satisfaction is not going to drop. Basically, many hospitals have other types of things they give to mothers. And I don't know why we give gifts anyway. Nobody gives you a gift when you have your appendix out. But babies are fun. They're happy. It's a neat time. And it's all right to give mothers stuff. It's just, what are we giving them? And who's it from? So we need to remove formula materials from clinics, from hospitals. We need to ask our attendings and our physicians to avoid giving out formula company materials in their offices. Ultrasound offices should not be giving out formula stuff. Okay? We shouldn't be handing out formula company materials or materials from any company that violates the code, bottle manufacturers or anybody else. None of that should be given to mothers. We shouldn't be going to these educational offerings sponsored by these companies because mainly they're a form of marketing. And again, they are done specifically to entice the healthcare provider to look kindly upon that product. We don't accept gifts from formula salespeople or any company that violates the code. I've seen some hospitals have, one of the hospitals I worked with had a contest to see how many formula company items and how many items from code violating companies could be found on the maternity unit and throughout the hospital. And they had bins full of this stuff, and it was very eye-opening to everybody when they did this. So we want to avoid distributing materials from code violating companies. These should not be given out to mothers. There are plenty of materials in terms of educational materials or instructions that can be either made by your own facility and your own people or that are out there that can be used and that are created by companies that do not violate the code. In other words, they meet their obligations under the code. Okay? Giving out this stuff from companies that violate the code rewards them for poor corporate behavior. they should not be violating the code. They can manufacture and sell all the bottles and artificial nipples and formula they want, as long as it is done in a manner that is in accordance with the code. The code does not forbid this. It simply looks at how the products are marketed. Now, I had a nurse tell me that, Marcia, get a life. This stuff is all free. Why should we turn it down? And I said, oh, now wait a minute. This stuff isn't free. That lady on the left has a target painted on her back, and that's a marketing target as a new mother. Okay? This stuff is not free. Who pays for it? The mothers pay for it. Okay? Mothers are targeted heavily throughout pregnancy and in the hospital and throughout the first year and beyond. These marketing efforts are what drive up the cost of formula. Now, all of that marketing costs money, and that is passed on to the mothers who buy that formula. When you go to the grocery store and you look at a can of powdered formula, there's probably not more than 25 cents worth of ingredients in that can. Yet that can cost anywhere from $25 to $40. And so the markup is tremendous, and the markup comes from, a good portion of that markup comes from marketing. Okay? Many mothers can't afford the dinners that are given to nurses and physicians when they're wined and dined with these educational offerings. That dinner is something that many of the mothers we take care of could never afford, yet they're paying for that dinner. So we have to recognize this. This new formula, this Inspire from Mead Johnson, on the right-hand side, there was a question and answer document that was up on the Mead Johnson website. And one of the questions was, well, what will Inspire cost? What's it going to cost? Okay, well, obviously the retailers determine the cost, but Inspire has a suggested retail price of $40, which is approximately 50% more than regular Enfamil and Gentle Ease. Now, mothers are paying 50% more for about 1 gram of artificially produced product that is going into that formula. This particular formula, this milk fat globule membrane, okay, is marketed to look like it comes from human milk. But the thing is, it's extracted from cow's milk. Okay, but mothers don't know that. And now they're paying $40 for something that is unlikely to make any difference in the health of their child. So there's always resistance to change. There's resistance to the code, there's resistance to baby-friendly, there's resistance to buying formula, there's resistance to getting rid of discharge bags. There's a lot of resistance to all of this because change is hard. It's not easy. Okay? What I put up here is kind of a list of things that I've heard about baby-friendly and about the code. That if we don't give out the discharge bags and we don't give them all this free formula and all this kind of stuff, is that it's going to make women feel guilty, or it's going to deprive poor women of these gifts. Okay, and we know that this is not true. Guilt is you can't make somebody feel guilty. Okay, our promotion of breastfeeding is not something that we need to worry about in terms of making people feel guilty. Okay. We are not depriving women of anything. Okay. If they need formula, they could purchase it. It can be distributed through the WIC program. There are always ways of getting food to babies. Okay. I've heard people tell me, but formula is safe and healthy. Millions of babies have been raised on it with no problem. So what's the problem here? Well, that's not exactly true either. Okay. Infant formula is not the same as human milk. And it's not an issue here of right or wrong, bad or good. It's an issue of the two are different. One is not equivalent to the other. Okay. I've had nurses tell me, we need to give out these bags. Well, actually you don't, because all of the states that have eliminated these bags have not had any problems with breastfeeding. Okay. Bag removal interferes with doctor-patient relationship, and I'm still trying to figure that one out. How where that one came from and why anybody would even think that. Okay, the code is not outdated. It's for all countries, and we all like to think we're not influenced by advertising. I like to think that myself. Yet I find myself purchasing products or looking at products based on what the manufacturer is telling me. So we have to recognize this in ourselves. So then what can we give out? After all of this lecturing here that I'm doing, well, what can we do here? What can we give out? Well, you can give out basically lots of stuff, non-proprietary materials, materials simply that do not come from code-violating companies. Make your own discharge bags. I have a picture of that coming. Many hospitals now have discharge bags that have their own hospital logo on it. It says, XY Hospital delivers. You know, we have the best care anywhere. And when the mothers carry that bag through the shopping malls, et cetera, you're advertising your own services, which are superb services and that you want the public to know about. You can give out pump kits, that's all right, instructions for the use of a pump, coupons and products from code-compliant companies, contact information for community breastfeeding support. I've seen some hospitals don't give out anything. All they give out is a bag with all of the maternity supplies in it. And I've seen some really creative things being given out by hospitals, and I put a picture of something like that below. I worked with a hospital one time that was affiliated with an assisted living complex that was on the same grounds. And my mother had been in an assisted living complex, and I noticed when I would go to visit her that many of the ladies there were extremely creative and talented in terms of what they were knitting and crocheting. Just lovely things that these ladies were doing. And so we talked about this at this hospital and with the assisted living management people. And we asked these ladies if they would like to crochet little sweaters and booties and hats for the babies in the hospital when the babies went home. And this idea was just grabbed. They got the yarn donated, and these ladies made these beautiful little outfits for the babies so that when the mothers went home, they could pick whatever color they wanted. They could pick pink or blue or yellow or green or white or whatever of these little outfits. And this was exceedingly popular. And it was actually something that the babies and the mothers could use. So I know you're very creative. You have to be creative to be in this business. And this is just samples of discharge bags that have been put together. On the right-hand side, Boston Medical Center has a discharge bag with goodies in it that can be used by the breastfeeding moms. The picture on the left is from Harlem Hospital in New York. And those are things that went into their discharge bag. And obviously these things change as you go on, but you can make your own bags. You can put some really neat things together. I saw one hospital had this group of mothers who collected old blue jeans. You know, when your blue jeans wear out and there's holes all over them, you can't even use them for cutoffs anymore. Well, these women were able to take these blue jeans, these old blue jeans, and make discharge bags out of them, out of the top part of them with the pockets, and they decorate them, and oh my goodness, they were so creative. So there's really neat things you can do in terms of making something that is creative and code compliant for your moms. And so what I'm going to do now is leave us with about 15 minutes or so to ask questions or concerns or anything that might be on your mind. And the other thing is, if you think of something after we're done with this webinar, you've got my email address, and I am most happy to take any questions from you that you think of further down the line. Just email me, and I would be happy to do the best I can to help you. So that if you got anything on your mind right now, go ahead, fire away, and let's see if we can answer some of the questions that you might have. And I'm going to look at my chat box here. And Rebecca, you're going to look at yours. And you're going to tell me if we've got any questions.
Just a reminder, if anyone's on mute, you can unmute by pressing #6. if you have a question. Oh, I see someone. It says, can you speak on pacifier use or picture the pacifiers?
Oh, you're breaking up a little bit. Can you repeat the question? Oh, did we lose her?
It sounded like she said, can you speak about pacifier?
Pacifier use? Or is this the question? Okay, I don't know what the question was, but if it dealt with pacifiers are generally not covered under the scope of the code. So it's not a product that's covered under the scope of the code itself. But the use of pacifiers in the hospital is controversial because it can displace sucking from the breast. And so generally the pacifiers are discouraged from being used. And I don't know if that was the question or not. And you can type that into the chat if you want, or certainly email me if I didn't cover what the question was. Okay, I'm seeing, let's see, as we work on our fair market value and code compliance, this should be across the departments, including NICU and pediatrics. That's right. We want to make sure all the departments, and even it's not even just NICU and pediatrics, it's also your emergency department and any other portal of entry into the hospital where a mother and a baby would be coming in. The ultrasound department, your imaging department. So it would be across all of the different units and departments in your hospital. Yes. Anything else on your minds? Oh, here's another one. Any tips or innovative ideas for tracking formula use? Oh, that's a good question. In terms of, I'm going to guess you mean by tracking the use in on the maternity unit. Now, when you track the use, do you mean counting bottles that are used? I know any hospital that uses a medication distribution system, like a Pyxis system, is a fast and easy way of tracking formula use. And many hospitals have started to do that. In other words, they put formula into the medication distribution system just like any other medication, and it's tracked very easily that way. Otherwise, you're tracking it by hand, okay, which is a little more difficult. And that again can be done by charting. In other words, you would chart if a bottle was used. You keep all of the bottles in one central area, and each time a bottle is taken from that area, it's signed out. And you can do it paper-wise by simply having the nurse sign it out. And that can be tracked for your bottle-feeding babies and your breastfed babies, cesarean moms, et cetera. I've seen hospitals use it that way, where it's simply tracked by paper. So there's a couple ways of doing that. And I don't know if that answers your question or not. And again, if it doesn't, feel free to contact me and we can talk a little bit more about it. Oh, good question. Why? Let me read the question. As a provider, legislation prevented me from accepting pens or pads or lunches, et cetera, from pharmaceutical companies. Absolutely. Why isn't this legislated? Why is this simply regulatory, as it seems similar to pharma marketing? This is an excellent point. It's not legislated because the U.S. has not legislated any part of the code at all. Okay, it's very hard to get something passed through the legislature. One of the things we did here in Massachusetts is bypass legislation when we were trying to eliminate the formula bags from the hospitals, and we went to our Department of Public Health because they are the ones that promulgate the regulations that license hospitals. And in the perinatal regulations within that set of hospital regulations can be put the elimination of all of this type of stuff from hospitals. So if you want to bypass legislation, which is very difficult to get passed, you could go to your respective health department and work on it through your state hospital regulations. And again, I'm happy to talk to you about that too. There's a process for doing that. But you're right. Okay, next question. Is there a standard for across the country? Okay, is there a standard for fair market value across the country, or is this established by whatever the pharmaceutical is willing to negotiate? Okay. There are a couple of ways of doing this, and it can get confusing. But if you want to contact me by email, I'm happy to go through this. You can look at what the hospital pays for other types of products that are used on the maternity unit, or you can do it as a percentage calculation. So there's a couple ways of determining this. And I'm happy to help you do this or point you in the direction with resources so you can see how some hospitals have calculated this. And like I said, it will be determined based on how you want to calculate it, and then the agreement that you make with the formula company who you're purchasing the formula from. The other option is to look at, if you want to cut down on costs, is to look at purchasing formula from the manufacturer of the store brand formulas, because that's much less expensive. And so that's a third option in terms of your purchasing options. So again, I'm happy to talk to you about that. Oh, how does code compliance apply to the gift shop in our hospital? Oh, you have such great questions. That's a good one. The gift shop should not be carrying any products that are from companies that are not meeting their obligations under the code. There should not be products in there that are covered under the code. I also ask hospital gift shops not to carry products from code-violating companies. Now, that's something that you're going to need to work out with the gift shop. Many gift shops that I've seen now have turned from the little gift shop that had a bunch of flowers that you could buy to big boutiques, and some of the bigger hospitals. Holy mackerel, you can go in there and do your Christmas shopping. So what you want to do is talk with them about why you don't want particular products there, and then give them an alternative. And there's very, very cool alternatives to a lot of the products that are out there that are from companies that do not violate the code. So yes, you want to talk to them about it. Oh, modifying the matrix used to determine fair market value. Yeah, I've heard a little bit about that, but I don't know what it looks like yet. I used to be on the board of directors of Baby Friendly, but I am no longer, so I don't know what that looks like. Best thing to do is to ask Baby Friendly themselves if they can give you that matrix. And again, I'm happy to help with this if there's any way I can help you with it. Determining fair market value is difficult when you're used to getting something for free. And so fair market value is it's become complicated because when you have big purchasing agreements, if you have purchasing groups, then you have to work through that too or do something different. So again, I'm happy to help out with that too if you would like to email me, or we can even talk on the phone if you want. Oh, fair market value for the specialty formulas. Again, you can use the same type of calculations, but those specialty formulas tend to be exceedingly expensive. Sometimes you can work this out with the formula company directly, okay, because they want to negotiate this because they want their product in the hospital. So you have some leverage in all of this negotiation, because you can simply say, oh, if we cannot come to an agreement on fair market value, we'll simply go to another company. So you've got a little bit of leverage there. And you say, look, if you can't give us a decent price on this, we'll go somewhere else. So that is a fallback that I've seen some hospitals use. We might not say it in those exact words, but it's a fallback that you have. So you have some bargaining power in this, and you can usually get these products down to something that is a little bit more fair. But again, I'm happy to help with this. Okay, New York has regulations which prohibits formula marketing. No samples, gifts, bags not allowed now. And again, this is something that cities can do and states can do. Okay, so that you certainly can do this through other venues. Okay. It's not easy. All of you on this call are not going to be the most popular employee of the month at the hospital where you work, because these things are very difficult and they're hard to change. So again, there are creative ways of getting this done, but good for New York. Anything else? Rebecca, do we have anything else? Have you gotten anything? These are
I don't know. Can you hear me on this phone?
Yeah, I can hear you. I don't know if everybody else can, but these are excellent questions, just superb.
Okay. Yeah, I don't see any more questions in the chat. But
is there anything else that has come up, Rebecca, in your work with this that you think people might want to hear?
I think two of the questions that I sent out were from us asking. I think the last one was from us. Yeah, but I think you answered most everything that we had on our side.
And I don't want to be vague or anything on these calculations, but the thing is there are a number of different ways of doing this, and that's why we would have to figure out what's best for your institution and what's going to work best for you. So I know this is a big part of this. Anything else, Rebecca?
I don't think there's any more questions. The recording of this webinar will be up on our website probably by this afternoon.
Okay.
Yeah, and we just have our next webinar is next week at a different time. It'll be at 12 p.m. Central, and Dr. Lori Feldman-Winter will be talking about safe implementation of skin-to-skin. So hopefully everyone here can join for that one as well. Yeah, if anyone has any other questions for Marsha, feel free to email us to get her email if you missed it, or email her. Thanks, Marsha, for your awesome presentation. That was really great. And
well, thank everybody for being on, for your patience. And again, I am most happy to help with any questions from this webinar, or if further down the line something comes up, please feel free to email me, and I'll do my best to answer the question or to find the answer for you. Thank you all very much.
Awesome. Thanks, Marsha. Bye, everyone.
Bye-bye.